Hey guys, this is Dr. Mahajan from Mahajan Medical Center. I'm doing a teaser for our full show tomorrow at Thursday at 4:30 p.m. For those of you who don't know, I'm a board certified internal medicine physician here in Largo, Florida, and I do every Thursday a Facebook Live, and we also webcast it on the YouTube at Mahajan Medical Center YouTube channel. So if you have not already subscribed, please do subscribe to our channel. Today's show, we're going to talk about dementia, caregiver, how to support a patient with dementia, whether it's your wife, your mom, your dad, God forbid, or your sibling, how you can support someone with dementia in your family. We're going to give you some basic tips today, and we're going to have David come tomorrow on our show. And David is a very good resource. Unfortunately, his wife has dementia, and he is managing her care and has a lot of great insider tips or personal tips as well to how to handle different and difficult situations. So we're going to go at length on that tomorrow. Um, um, on the Also today we're going to reintroduce you guys back to the breathing technique, which is called victory breath or ujjayi breathing, and that will be again we'll practice tomorrow as well after we discuss the dementia caregiving tips with you. Again, this is Dr. Mahajan from Mahajan Medical Center. Um, we're going to be live tomorrow as well. So let's get you some simple techniques or tips to help with the dementia caregiving. I know it could be challenging. Before we do that, let me thank everyone who put comments on our live feed, part one of the dementia, where we went over the cause of dementia and the the treatment modalities and the symptoms and the signs and how to test for it. Um, so anyone who commented on that will be automatically put in a raffle, and we're going to on our live show tomorrow pick the raffle winner. So do tune in tomorrow if you did comment on our dementia part one to see if you're a winner. And then when we do the event tomorrow with David, if you comment during the live show or after the live show as well, if you put a comment or a question, then you'll be for the raffle for our subsequent podcast or webcast when we do that on the Thursday after show. So that way, anytime you comment and you get automatically into $25 public gift card raffle. So a lot of our folks are excited by it. So I'm glad we had so much participation on that on the live webcast on our previous Thursday show, and we're going to pick the winner, as I said, for the $25 Publix gift card tomorrow. So do tune in if you did put a comment, and if you didn't win tomorrow, do a comment again. Maybe you will win another raffle next time. So that's a good way for us to entice you to make sure you're not a silent observer, but participating in this community effort, which I'm doing with your help. If you have anything we can improve, please do comment. If there's a topic you want me to pick, please do comment today or tomorrow. If there is a breathing technique you enjoyed and you're doing it and you're feeling the benefits, since we've been teaching for almost 4 months now, do comment. Or if you're having any difficulty with any of the breathing techniques I taught over the last 4 months, let me know. All right, so Let's see, we got a couple of comments already. Let's see what who Mark is saying. Why not show how to prepare good food for you? And that's a good idea. It's we'll see if we can. I think that gave me a thought. We should talk about the healthy diet and as part of and maybe bring some recipes. Um, Sandy, thank you, Sandy. Sandy is sending us love, and we are sending love back to Sandy. Thank you for listening, Sandy. We got Tabitha Main saying, thank you for education you provide. Thank you for tuning in, Tabitha. That's very kind of you. Do tune in tomorrow so that way you could be part of the raffle we're going to be doing for $25 Publix gift card. All right, so let's talk about what are the tips I can give you to help if you have a dementia patient, or if you're let's say LPN or nursing aide working in a memory unit. Those tips will work for you as well. So the number one tip is set a positive mood for interaction. So I think that's very simple. You use facial expression, tone of voice, physical touch to show that you're affectionate to that patient. If you're a professional caregiver, or if you're a family member, that you're affectionate family member. And the body language and attitude communicates your love more than the words. So that's all the cues come from the body language. So it's very important to set a positive mood for interaction with a dementia patient or memory loss patient or any patient with chronic needs. So number two tip is get the person attention. So limit the distraction, turn the TV off, shut the curtains, make it a quieter environment. So that will get their attention. If they are seated, you see at the same level, and that way you can make eye contact, and that will help get your message across. Number three tip is state your message clearly. So the key is to speak directly to them, rephrase the question, wait a few minutes and see if they understand. If they do understand, keep it simple and use people's name instead of he or she or abbreviations with the dementia loved ones. So that way you can get your message across. And when you're asking a question, keep the question simple. And for example, would you like to wear a white shirt or a blue shirt if helping them dress up in the morning or something? So, and better just give visual cues, show the white shirt or the blue shirt to them, for example. That way they can get the message across and they can answer better, and you'll have less frustration. The next tip is obvious, but sometimes we get overwhelmed with the caregiving and we don't listen, but listen with your eyes, ears, and your heart. So, what I mean by that is be patient. Always try to listen for the meaning and feeling that underlie the words. So they may not be expressing exactly, but if you know that person well, you can understand what they're trying to say. So if you're patient, you will get to the essence of what they're trying to communicate. The next, number 6 tip is for caregiving of a dementia or memory loss patient is break down the activity into series of steps. So that's very self-explanatory. Just instead of saying the whole task, just break it down into small steps, and that will get their cooperation and less frustration from you. The next tip is when the going get tough, redirect and distract and redirect. So, for example, if they are feeling sad and you want them to go for dinner, just say, I see that you're feeling sad, and just say, how about going for a walk? Now you took the dinner out from the phrase and you redirect it and you connect it with them in their emotions, so that will get you a better response. And always respond with affection and reassurance. Um, and the key part here is avoid telling them they are wrong, because that leads to confrontation. So, if they're saying, it's something not right, that's not right. But instead of arguing, just go along with it if you can. I know sometimes it could be frustrating. So respond with affection and reassurance, and don't try to tell them they're wrong. And that's a good one. If you remember the good old days, if you are a wife or husband of a loved one and you have a lot of good old days, because they won't remember what happened 10, 15 minutes ago, but they will remember what happened 20 years ago, 30 years ago. So if you can have pictures and go over the pictures, or if you have music or something which brings those memories back for them, that will be a good way of getting them in a happy zone. So, and plus it will help you to connect with them. So that's another simple trick, but very helpful. A last number 10 tip: maintain your sense of humor. So it's hard, you are going through seeing your loved one who was so functional, and now they are having to, just for simple tasks, needing help. It's devastating. But if you can find humor, and Charlie Chaplin used to say, a day without laughter is day wasted. In fact, I run that in my TV screens in my office to remind me, and I use humor all the time with my patients as well. I think humor is good for caregiver, like for example, provider like me, to get through the day when I see so sick patients and I see patients who are suffering. So same thing as a caregiver, if you use humor, it will get you not get burnt out, and you can get through the day a little bit better for you. All right, so those are the 10 tips, and we'll post it today on our comment section if you missed any of those, and that way you can write it down from our comment section. Um, in case you want to share your personal experiences and stories of caregiving and what worked other than these 10 tips, please put in the comments and we'll share with the rest of our audience tomorrow. Let's see. We have a few more comments here. Steve is saying, thank you. I do dementia training regarding behavior. This is important information. Thank you, Steve, for kind words you do. It's a difficult job, so thank you for doing the difficult job. And I'm happy that we can add something to your toolkit. We got Angel. Angel is saying, great information. Thank you, Angel. Angel is a loyal listener of our webcasts for a long time, so we appreciate her support. Let's see. Amy has a comment. And she had a suggestion as well. You can tell a lot about how they feel by knowing them and their usual behavior. Watch for clues that something may be off. That's a great suggestion, Amy, and we see it all the time in our memory units. That if they're not, their regular self, there could be a urinary tract infection, or God forbid, a fall, or the medication has been changed, or they could be depressed, or they could be upset. There could be a host of different things. So yes, so if you know them well and something is not right, don't blame it on dementia. They do get other things too, like uncontrolled diabetes, hypoglycemias, lack of sleep, urinary tract infections, electrolyte imbalance. They can have anything you and me get. It's just that they can't express. So that's a great pointer you gave us, Amy. All right, so we always have a section about breathing, and today I'm going to bring back something I taught you guys few months back, and I hope you're practicing it. It's one of my favorite pranayam or breathing technique. Let's talk about the word pranayam. I use it quite a bit. It's a yoga word. What pranayam means is prana, which is a Sanskrit word. Prana means your breath. Ayam is the second part of that word, which means stretching, so or keeping it a little bit longer or alive. So, so let's connect it together. You're stretching your breath, or you're making your breath, get a little bit longer or a little bit more beneficial for you. So pranayama is a beautiful word, and it's a breathing technique. And why breathing? And I emphasize it all the time that breathing, if you think about it, is one of the few things we do without thinking. Sleeping, we do the breathing. Talking, we still doing the breathing. You're working, you're doing the breathing, and you're not thinking about it. And most of the time, when we do the breathing without thinking about it, we're not getting the full benefits of the breath. And the inhalation affects your sympathetic system, and exhalation affects your parasympathetic system. So if you can master some of the breathing techniques I've been teaching you, you can have the benefit of controlling your autonomic nervous system. There's not many parts of the body which has easy access to autonomic nervous system as the breathing does. So that's why, with every webcast I talk about pranayam, just because it's so vital for our stressful life with COVID, with just living. All right, so let's talk about victory breath. The victory breath is a beautiful breath where it's a sound generated breath, and it helps you calm your mind. So it's also in yoga circle called Ujjayi breath. So what does it entail? So you sit straight and tall, keep your spine straight, go in a quiet room, and breathe in through your nose normally. And then I'll break it down to two steps. When you breathe out, I want you to do this like you have a mirror in front of you and you're fogging the mirror. So breathe in and then fog the mirror. Breathe in again and fog the mirror. This time when you breathe in, get to the highest level you can breathe in and hold for 1, 2, 3. So breathe in, 1, 2, 3, and breathe out. Now we're going to do the same part, but now we're going to exhale out without the mouth being open. We're going to exhale out through our nose, and we're going to restrict the breath coming through our neck or the trachea a little bit. So it will sound like this. This will sound like a whooshing sound, or like you're whispering in someone's ears. So it will sound like this. So it's like an ocean wave going through, and you're near a shore in Clearwater Beach, and you're listening with your eyes closed to the ocean wave. So it's a white sound. So it kind of centers your mind because it has a sound effect too. So again, so you breathe in through your nose, get to the highest level of the breath, and then wait for 1 second there, and then breathe out through your nose and create a sound as if you're whispering, or Darth Vader breathing, or a little bit constriction in your trachea. So it will sound again like this. We'll do 5 of those this time. So you breathe in through your nose and hold tall, and then breathe out. Three more. One more. Again, very simple. You're creating a sound like a ocean wave as you're breathing out, and it should help you center your mind. And it's called victory breath or Ujjayi breath. So practice that, guys, and we'll practice again tomorrow with you at 4:30. We're going to be back with our special guest, David, and he's going to give us more caregiving tips for dementia patients. And we put the link for these 10 tips and more explanation for that. Hopefully those help. And we're going to have the winner for the raffle for the people who put comments on a dementia part one. If you didn't get a chance to listen to dementia part one, it's on Facebook Live Mahajan Medical Center page. Do go there and like it. And also it's on our YouTube channel on Mahajan Medical Center. Do subscribe to it. With that, we come to the end of our podcast. And we want to have you stay safe and keep the social distancing going. I'll see you tomorrow at 4:30. And be nice to yourself. Be nice to your fellow human being. Be nice to the biosphere and planet Earth.